Thank you for joining our COWHA Fireside Chats. So today we are joined by Mokgadi Mashishi, a leading advocate for women's health globally, as well as the country lead Africa Access Markets Organon, as well as the final title. She's the COWHA Chair, Coalition for Women's Health. So thank you, Mokgadi, for joining us.
Thank you so much.
So we're going to have a very candid conversation on access of these contraceptives to the young people that need it the most. So could you tell us a little bit about your role at Organon and how that role is improving the access of these contraceptives, or rather the reproductive health products for these young girls in Africa?
Absolutely. Thank you so much for having me. And I'm really looking forward to the conversation. So in terms of Organon, maybe let me start there. So as Organon, we are a pharmaceutical company. So we're actually in the business of the women's health economy. And when we launched our organization in 2021, in the middle of COVID, our intention was to launch more than just a company. We launched a commitment to women's health. Therefore, it was a commitment to women and to girls, because we fully understood and appreciated the fact that women are actually the backbone of society. And in order for society to prosper, women needed to prosper. And in order for women to prosper, they need to be healthy as well. And part of the health also speaks to reproductive health as well. And if we think about the reproductive health journey of a woman, it starts when they are still a girl, right? So our commitment is also to support women throughout their life journey as well. And then in terms of my role as the country lead for our Africa Access Markets, it's more about how can we find ways to lift some of the barriers to access that exist on the continent. So as Organon, we see ourselves more than just the manufacturer of the products and the solutions and innovative solutions as well, in terms of treatment, but we also see ourselves as an integral part of the ecosystem that enables access to commodities. So when I say ecosystem, I just want to expand a little bit on that, because we work very closely with governments. We work closely with different partners. Some of them are more in the implementation space, others are more in the development space, and then there's also the funding aspect as well. So we work with these partners, including the healthcare providers themselves, but also those who are receiving care, right? Because at the end of the day, it's about them. So we work with them to see what are some of the barriers to access that exist, and we try to also come up with solutions that are country specific, and that we can only achieve if there's involvement of the country itself and there's a full commitment from the country, but also to those who are accessing care. Because I do believe that the days of providing care our way is gone.
It's good, yeah.
You cannot come up with solutions and impose them, right? You actually have to understand what the issues are before you can actually come up with the solutions. So part of my work involves understanding what are the barriers that we need to support in terms of lifting, and this can be either in the policy space, which would then require a lot of advocacy, and then there's also the element of the supply chain. You find that sometimes, even though as the manufacturer we have sufficient supply, there is other challenges in the system that are actually impacting the stock outs, that are generally also highlighted as an issue when it comes to access.
So I like the point that you brought about access.
Yes.
So from your experience, what are some of the barriers between that availability to the access of these contraceptives to the adolescent girls? Yeah.
Okay. No, that's a good question, actually. And I want to start, maybe address it in three buckets, starting from the manufacturing piece, and then, that manufacturing piece will address the supply chain piece. And then coming to the policy landscape as well, because that is critical. And then there's the financing piece as well. And more importantly, there's also the social norms, right? So actually I said three, but it's four.
It's four.
So from a manufacturing perspective, when one considers just how massive the need for modern contraception is, it means there would be potential supply constraints, right?
That's true, that's
true. So if we take sub-Saharan Africa and you look at women of reproductive health age, and this would be 15, according to the guidelines and the guidance in terms of the age, 15 to 49 years old. Those are the ones that are considered to be women of reproductive age.
Yes.
There's about 54 million of them on the continent who have a need for modern contraception, right?
Yeah.
And you break that down further. And if we focus on the younger group, which, as you rightfully said, looking at the adolescents and the youth.
Yes.
We know that our continent unfortunately also faces high rates of unintended pregnancies, especially among teenagers and among children, which is actually heartbreaking.
Yes,
right?
Really, yeah.
So from a manufacturing perspective, we have expanded our production capacity to ensure that we do as much as possible to make the commodity available. And then getting it to countries. But then when it arrives, there's also the issue of addressing the last mile, where the women and the girls actually get access. So obviously that requires multiple stakeholders to be involved in that space. There's a saying that I like where they say there's a particular soft drink and alcoholic beverages that it gets to every corner of the world.
Yes.
Why can medicine not get to every corner of the world?
Yes.
So this on its own already calls for partnerships beyond the traditional partnerships, right? And then we now take it down to the financing piece, that there's a need for intentional investment in getting the commodities, but also ensuring that the facilities themselves are well equipped, there is good quality service, and the healthcare providers themselves, whether it's the community healthcare providers, the healthcare providers who are based in primary care facilities, and those that are based in higher care facilities are well versed and well trained to deal with the end user effectively in a way that is accessible to the end user.
I like the point where you brought about the community health promoters.
Yes.
You know, COWHA is a platform that advocates for women's health. We've been doing a lot of videos, a lot of grassroots engagement. We are talking to the young people out there.
Yes.
And a lot of feedback that you're getting is there's a lot of misinformation on contraceptive use. There's a lot of judgment and stigma, especially from the community health promoters or the community health providers. What is from a manufacturer point of view, what are some of the less visible barriers to access? Yes.
So I do want to also position us differently as Organon, that we are not just a manufacturer, so we are a partner in actually making sure that there is access. I think along with the ones that you've mentioned, there's also certain cultural beliefs. Like there are some policy elements that we also have to address. You find that a country decides that young people can only access contraception from the age of 18. But the reality is that they don't need consent to engage in sexual activity.
Yes.
Therefore, even though the policy might be saying one thing, how can we ensure that despite that we can ensure that there is services available for these young people? So there's also the element of the parent, right?
Yes.
So as parents, what is it that we are doing to educate our kids and also deal with the misinformation? Because I do believe we are in an era where our children need to understand and be comfortable in the sense that I can reach out to mom or dad and speak to them about things that are bugging me.
Yes.
Because they would also be a good source of information, right? But also in the health facilities, the community health workers or other healthcare professionals should be accessible to the young people without making them feel invisible, without judging them, without making them feel like what they're doing is sinful, right? And we also need the support of the traditional leaders. We need support of the religious leaders in terms of reframing how can we deal with this pandemic that is teenage pregnancies. So there is certain aspects that are nuances that can only be understood if there is further engagement of young people, making sure that their voice are actually on the table. I can share with you some of those as we are sharing now.
Yes.
However, there are certain invisible ones that might be invisible to us based on what we know. And we can only get those insights if we are engaging the end users, including the adolescents and youths.
Okay, that's quite informative. So let me bring another aspect. The involvement of men in these reproductive talks.
Yes.
We do notice there is a bit of limit when it comes to that. How can we change the narrative?
We need more men advocates, because at the end of the day, when we think about it, it takes two to tango, right? And then we also understand that there is other nuances, like there would be transactional sexual engagements as well. So how can we, how can men be advocates and stand up to actually say, this is what needs to happen with the boy child. This is how we as men can self-organize to ensure that we can be part of the change. Because women can deal with women's issues, we understand women's issues, right? And when it comes to the unplanned pregnancy, the unfortunate thing is that the girl child is the one who has the baby, who's stuck with the baby, right? How can we build a society where there is appreciation and respect that this is a joint, it requires a joint effort? And how can we ensure that men, and maybe we need to ask the men.
Yes, the question to men.
How can they actually be more involved? Because the other reality is that, well, maybe I might sound a bit biased, that a lot of times the young girls or the girls might be coerced into the engagement by men. Right? So how do we empower or rather provide the necessary information for men to understand how they can be part of the solution? And that engagement with them, only through that engagement with them will we understand how the solution can come forth.
Yes, with our advocacy videos that we do and the meetings that we have with the young people as COWHA, we do realize a lot of organizations are pivoting to support the girl child. And we do realize the teen girls, the ones that are married, or the young girls that are married, they more so listen to men. I mean, they sort of always submit to their men. So sometimes we may educate the women about the contraceptive use, but as well as they communicate with their partners, they're not informed. So what is your advice to these organizations?
I think it's key to bring men to the table, because as much as we talk about supporting women to exercise their power of choice, there are a lot of instances where women are not the final decision maker when it comes to the child spacing, when it comes to when are we going to have our first baby, and so on. So we need men to also be involved in that, in terms of the planning, but also them understanding what the implication of an unplanned pregnancy is for them. And actually recently in one of the engagements with the different stakeholders that we speak to, one of the parliamentarians said, as a man, I should also be concerned, because it means if I know we already have 3 kids, and then one day my partner comes and says, oh, by the way, we have an oopsie, we have a 4th child on the way. What does that mean for me as a man? It means that there is pressure on the resources that I'm bringing into the household. Therefore, I have to be part and parcel of the conversation.
And men
in terms of,
in African context, men
they are the heads.
And they're providers.
And they're also the heads of the households. And well, the issue of the provision, that is also another dynamic that we actually have to be openly in conversation about, right? And then ensure that men do not see women exercising their power of choice as some form of disrespect to their authority. It's a joint effort, because it takes 2 to have a child, and the child is a shared responsibility between the parents. So it's about also ensuring that men understand the contraceptives, and they understand that in the same way that your most basic medication could have side effects.
Yes.
How can they support their partner in that? And how can they support their partner when it comes to the choice of method? But when it comes to the adolescents,
Yes.
we need to ensure that within our education system or within our engagements with young people, we actually empower them to understand how their bodies work.
Yes.
Because to your point, what the young girls are raising,
Yes.
you could have one boy who engages in sexual activity with 10 girls. He doesn't even realize he's just planted 10 seeds, right? And if he understands the consequences of his actions, maybe then he will also be able to have that conversation openly to say, this triple threat that girls are facing, how am I contributing to reducing that? And how am I also contributing to girls being able to care for themselves, but also make sure that they don't actually end up, with infections, with babies that they have not planned for, which also leads to higher mortality rates, as we know.
Okay, thank you for that feedback. But there is something you brought up very important and very key: partnerships.
Yes.
It takes a lot of civil societies. It takes a lot of organizations to come together. It takes the government to come together. What are some of the policy shifts that are required to ensure there is contraceptive access? Yes.
Wow, that is an interesting one. Because as you can appreciate, when it comes to sexual and reproductive health, there's also a lot of sensitivity around that, right?
Yes.
So one of the policy shifts that maybe let me bring this as an example. So Rwanda recently reduced the age for access, right? Those are the sort of policy shifts that start to shift the narrative.
Yes.
And it doesn't necessarily mean by making contraception available, you are giving young girls and boys authority to go out there and have sex. You are merely providing an avenue for them to say, in case this happens, this is you have an opportunity to access care. So I think countries need to sit back and look at what are some of those policies that are, it could be that it's unintentional, that the policy ends up being a limiting factor. So it's about sitting down and looking at reviewing those policies and saying, for our country in particular, these are the limitations and this is how we can lift them or update them in the context of today's in today's day and age, to ensure that they are relevant to this current situation's context. And this would include policies on the age, as I mentioned, policies on how we deal with gender-based violence, because we also know that some of the pregnancies that occur is not out of pleasant situations, right? So that has to be quite intentional. There has to also be consequence if there is elements that are related to that. And then also ensuring that there is specific budgets that are allocated for acquisition of those commodities to address what I mentioned earlier, where I said that, as a supplier or a manufacturer, we might be expanding our operations to ensure that there's no out of stock. But if the budget is not there to purchase, it means there is no access, right? So there might be a need to also shift policies in terms of how finances are allocated. And I think for that one in particular, there's a need to have that appreciation of the dividends that one gets from investing, particularly in family planning, right? And beyond that, by also investing in the care of women during pregnancy and before pregnancy, in terms of building on that economic benefit that will ultimately happen, because you'll be able to achieve the SDGs such as gender equality, such as access to education, improving health, and ending poverty. And also it touches on planetary health as well, right? So the investment case for investing in women's health and in family planning and in other areas that are aspects of women's health is absolutely critical. Looking at the care of women in general, but bringing it back to this particular fireside chat where your question was specific to contraception and to young people. Because Africa has the highest young population. Well, I think 70% of Africa is young people under 35.
Yes.
However, if we are losing majority of them to unplanned pregnancies, how are we going to ensure that Africa continues to rise?
That's a good question.
It's a very good question.
Yes.
Which means when we start to look at the policies from that lens, and then we can be able to say, we can reach young people through digital channels.
Yes.
What are the policies that are governing telemedicine? What are the policies that are governing the digital space? We can reach young people by ensuring that there is youth-friendly services. What does that look like?
Yes.
And then in our policies, how are we driving for that?
Yes.
And are we really making this center and front in every ministry? Because it's not just the Ministry of Health's responsibility. The Ministry of Social Development is critical. The Ministry of Gender is critical. The Ministry of forestry and environment has to be involved. The Minister of Education. So it actually requires multiple stakeholders to take ownership of this and take it forward. It's not just a health issue.
You've touched on something that I'm very passionate about, youth friendly.
Yes.
And the aspect of supply chain.
Yes.
So from Organon's perspective, how do you ensure that the products that you produce, or rather the user, you're able to get or rather access feedback from them to ensure that they're well packaged? There's the aspect of access also in it. So how do you gather the feedback from the end user? Yes.
So one of the things that we say about pharmaceuticals is that we are probably one of the few industries where you don't have the ability to engage directly with the end user, your customer, right? So we achieve this through partnerships. And it's through partners that we work with that we are able to then get additional feedback from the end users, and then look at how can we improve on the products that we have, and then also the services that we have. So partnership is key in terms of driving that. And then, as I mentioned, we are quite intentional in listening in on what the needs are. One of the needs that have been highlighted is how can we simplify access for one of our products, and we've done that by making sure that how the insertion works is much easier.
Yes,
it's very easy to insert with proper training and so on. The technique is easy. The gadget is also friendly for the HCP, and then also making sure that the healthcare professionals are well equipped. And this we also do through partnerships, because we cannot engage directly. And then we ask for feedback, and that's the feedback that helps us to continuously be able to make the necessary changes. And I think also investing in platforms such as COWHA, because as you know, Organon is one of the principal founding members. And the key was to ensure that we can have other structures to gather feedback without contravening the regulations that govern our industry, right?
Thank you so much, Mokgadi. And we've seen you in global spaces, and also being part of the principal founding member of COWHA. We've seen how passionate you are in the women health space. We'd like to know what keeps you motivated to do this work.
So what gets me out of bed every day? When I think about how family planning has changed my own life, and how ensuring that access to quality care, to quality products, to proper information can transform lives. That's what keeps me going. Also looking at the fact that I have a daughter, I have a son, I have many daughters, so I consider my nieces to be my daughters. I consider the young people that I meet in different spaces to be my daughters and sons as well. And I think for me, building a better world than what we found the world in is what keeps me going. And then Also, I'm quite passionate about ensuring that the young people can achieve their full potential. There are days that are hard, right?
Yes, yes.
Where you hear the true realities that young people face. And the question that I always ask myself is, what can I do with what I have today as I look forward to what the future could actually hold? So it's about really acting on what we have now, based on the knowledge we have now, but also looking at what the future could look like, anticipating that, and also looking at the fact that what we do now will have impact on the future generations to come. So my children's children will benefit from this. And funny enough, I have been called Mama Africa, so that's my other name,
you deserve
right?
it.
And I always say I celebrate the fact that I have children across the continent,
yes.
daughters and sons, right?
Yes.
Even beyond my biological ones and those that are linked to me by blood one way or another. And some of the policy shifts and changes that need to happen, it's also in the protocols that we actually put together, as government and so on. So there is a need to be intentional about including contraception in the antenatal journey of the women, right?
Yes.
As well as in the curriculum where we're teaching young girls and boys about their bodies so they can understand, right?
Yes.
But in terms of the protocols for treatment and that, we have to make sure that contraception is also central in the woman's antenatal journey. Because by so doing, we are ensuring that by the time she gives birth, she already knows what she's gonna do postpartum.
Yes.
Right? It's not
important. Yeah.
She has had time to reflect, she's had time to ask the necessary questions.
Yes.
And by the time she gives birth
Yes.
and she leaves the facility, she leaves the facility with a solution
Yes.
that will enable her to focus on her baby, right? And ensure that she doesn't end up with Irish twins,
Yes.
right? Or babies that come too close to each other.
Yes.
Because that doesn't only compromise the baby that is already born.
Yes.
It also compromises the health of the woman.
Yes.
So as governments and ministries look at the strategies for addressing women's health and addressing maternal, neonatal, child and adolescent health, there is a need to have that continuous linkage across the continuum of care
woman,
to ensure that family planning is actually rightfully brought up. It cannot be a silent solution in the strategy.
Yes.
It has to be an intentional solution. And I always say that there's a very good it's actually a lecture, part of the lecture series by Professor Joy Lone, and it focuses on why it matters to prevent those unplanned pregnancies. Because if you look at the maternal mortality, what leads to high maternal mortality? Pregnancy. I guess that's the starting point.
Yes, that's the beginning.
And then what leads to high child mortality? Pregnancy. Because if we are spacing the children, we're giving the mom time to recover and the baby time to actually be looked after well in their first 5 years of life.
Yes.
We look at the high mortality for the children under 5. What increases that? Unplanned pregnancies, right?
Yes.
And then we look at the adolescents. One of the SDGs is for healthy adolescents.
Yes.
But we are losing a lot of them to teenage pregnancies, as I mentioned.
Yes.
Therefore, the policies have to be intentional about bringing about the reality and the benefit of contraception in that case. And the young people have also said to us, but why are you calling it family planning?
Yes.
Is there a need maybe for us to interrogate this further?
Definitely.
Which families are they planning?
We do not have families.
Exactly.
I'm just a 16-year-old girl.
Exactly.
Yes.
And that, so maybe, and this is where we will invite young people as well to be part of the conversation.
They need to be part of the dialogue.
They have to be part of the dialogue. They have to be the ones who are raising their voices to say, these are our challenges and these are our needs. Interestingly, wherever you go on the continent, the issue that young people are raising is that there's limited access, there's judgment, there is, there's disinformation,
Yes.
and there is stories about, I mean, if you go and you get a solution, a particular contraceptive, and then you have a headache, you happen to have a headache.
Yes.
Now you go and you tell your friend, and your friend tells
Yes,
her, by the
yes.
time it gets to friend number 10,
Yeah.
the contraceptive has made somebody lose their foot, right?
Yes, exactly.
So those are the things that we really need to
Yes.
address by ensuring that there is proper access to the proper information, reliable information, and that again we can only achieve through appropriate partnerships and making the right information available. But we also need to know, where do young people want us to meet them? We have to meet them where they are and use the platforms that resonate with them.
Yes, which you mentioned earlier, the digital platforms.
The digital platforms. Yes. There's also, I mean, there's sports that they do.
Yes.
There is, in the same way that the women have clubs,
yes,
where we just chill and have discussions about multiple things, we can plant the seed of talking about health, right? In those, exactly.
Yes.
And then what are those type of communities that young people find themselves within, where it's an opportunity to educate them? And then when it comes to the facilities, are they open sufficient time for the young people to access them, taking into account that they go to schools, they go to universities, and the facilities might be closing at a time that is not convenient for them, and that speaks to the youth friendliness, right?
Yes, yes.
I think for us as Organon, and I've mentioned this, that we don't see ourselves just as a manufacturer, we see ourselves as part of the solution.
Yes.
So we launched Organon in June 2021, and as I mentioned, we launched this as a commitment to women, and then not just as a company. And part of that commitment was also to seek opportunities that could help us to amplify the voices of women, but also be able to respond to the needs of women. And coincidentally, Africa Health Business in February 2022 hosted a symposium, and the theme for that symposium was focused on women's health. I remember very well, the theme was Africa Women's Health Day. And as Organon, we knew that it was a no-brainer that we needed to be part of this, right?
Yes.
And then we hosted a side event, and we had themed it United for Her. And we invited stakeholders to come in and let's have an open discussion about what a unified platform would look like for women on the continent. And the intention was to understand, what are some of the challenges and the gaps in women's health? How can we respond to those effectively?
Yes.
And considering then the amount of initiatives that are on this continent and the investment that happens, how can we ensure that there's a better partnership and better unification instead of operating in a lot of silos? And through those conversations, some of the ideas was around this collective movement. And we spent time with AHP, and then we're joined also by Hologic as well as BD, and eventually 9 months later, exactly 9 months later, COWHA was born.
Yes.
And the intention was to amplify the voices of women on the continent, but also to bring about why it's necessary to to drive that equity. The gender equity is critical.
Yes.
Before we even get to the equality piece, we had to amplify and focus on issues that disproportionately impact women on the continent. So we launched COWHA then in November in Addis Ababa, and then we also launched in South Africa.
Yes.
And it's been amazing what we've been able to achieve through this coalition. And it's one of the things that also make me wake up with joy in my heart every day, to realize that we are building something that will outlive majority of us.
And even most generations.
And most generations, exactly. And one of my, absolute beloved proverbs. Because Africa is all about proverbs, right?
Yeah, that's what
it says, the true meaning of life is planting seeds under whose shade we do not expect to sit.
Yes.
And there's another one, well, this one might not even be an African proverb, that says, the best time to plant a tree was 20 years ago.
Yes.
But the next best time is now.
Is now.
And I think it's through that lens that we have been building on the coalition. And through the coalition, I do believe that we've managed to bring attention, the necessary attention to women's health,
yes,
and the health of women and girls. And we have been able to publish at least 4 publications,
yes,
starting off with a working paper. And then we had a report on cancers on the continent.
Yeah.
We had a report on sexual and reproductive health among adolescents and their postpartum care. And then we also have ventured into looking at the non-communicable diseases and how those impact women differently.
Yes.
And then we have also hosted multiple webinars focusing on different aspects that affect women, including the recent shifts in the funding landscape, which has been changing. And it's critical that as organizations we start to look at how can we support government in this transitional period.
Yes.
And I think while this was it's a challenging time to be in,
yes,
there's a saying that you should not let a good crisis go to waste.
Yes, that's true.
So now it's a great opportunity to reflect and build on things that will be sustainable for the continent's prosperity.
Yes.
And this is something that is higher level attention across multiple governments on the continent.
Yes.
And the focus has been really quite incredible. So we have contributed significantly to the addressing the equity piece, the gender equity piece,
yes,
health equity.
Yes.
And now I think we're progressing more into the equality space as well, and unlocking these channels. And the more we dig, the more we learn.
Yes.
So again, we are flying this plane. I mean, we are building this plane as we fly it.
Yes,
because you have to have that belief,
yes,
and that willingness to be adaptable as you go.
Yes,
and then also the ability to reflect and say, what do we need to do differently so that we can continue to pivot at an accelerated rate.
That's true, definitely.
Yes.
And I think we're on that process.
Absolutely.
Yes.
And while we talk about, if we want to go far, if you want to go fast, go alone. If you want to go far, go together.
Yeah.
Now we are changing that as well. We are saying we need to go far and fast together.
Yes.
Because the world is not waiting for us.
Yes, definitely. Talk about data.
Yes.
And what we need as a continent right now to make those informed decisions, to also support the policies. We need data.
Exactly.
Yes,
exactly.
Talk about it.
Okay, perfect. So the other element that will actually help the continent to progress is data.
Yes.
Data is the new currency.
Yes.
And without data, it's difficult to make informed decisions, but also difficult to track the progress that you are making. So there is an urgent need for that local data generation, as well as interpretation of that data into analytics that can help us to make decisions that will then influence the policy change, right?
Yes.
So it's critical that we invest in that, and then we're also calling on young people to be at the forefront of that. And actually, we recently joined the Health Tech Summit, which was also focused more on how to progress from an analytics perspective, digital perspective, as well as data as well. So I think it's also good to appreciate the richness of the data that is here on the continent.
Yes.
We do need to have that more organized in a way that can inform decision making and also inform the policy changes.
Yes.
But also enable us to measure the impact, right? So that is absolutely critical.
Yes, measuring the impact.
Yes.
Thank you. Yes.
Yes.
Thank you so much. And we really appreciate the work that you're doing. So from this conversation, we gather one thing, that contraception is not about the services. It's more about dignity, inclusion, and supporting our women and girls in Africa. So we at COWHA, we continue to amplify the community voices as well as link them to the leaders that are up there to ensure that access of contraception is everyone's business. Thank you so much.